Good evening, everyone. I would like to kindly thank each one of you for joining us live from Masa University Sarjana Putra campus. I am Shafinas from the Faculty of Health Sciences, Masa University, and I'll be moderating today's session. Today's webinar is hosted by the Faculty of Health Sciences, Masa University. The title of today's webinar is Hysterosalpingography, HSG, Diagnostic and Therapeutic Aspects. Dear viewers, before we proceed further, I would like to give you a brief overview of the programs offered by the Faculty of Health Sciences at Masa University. Okay, so at Faculty of Health Sciences, we have School of Physiotherapy, Department of Environmental Health, and Department of Medical Imaging. So under this School of Physiotherapy, we have Diploma in Physiotherapy, Bachelor of Physiotherapy, and also Bachelor of Physiotherapy in ODL mode, and also Master of Physiotherapy. So under Department of Environmental Health, we have Diploma in Environmental Health, Bachelor of Environmental Health and Safety, and Bachelor of Environmental Health and Safety in ODL mode, as well as we have a new program, which is Diploma in Occupational Safety and Health. And for Department of Medical Imaging, we have a Diploma in Medical Imaging, which is Radiography, Bachelor of Medical Imaging, and Bachelor of Medical Imaging in ODL mode. So why do you need to join health sciences? Because of a few factors. For example, we have a high job demands where we are the essential services, and there's no boring work routine, and we have lucrative remuneration, and there is also low risk of job redundancy where most of the job cannot be automated. We also have opportunity to work in a variety of settings, and health sciences is actually a career that you can feel good about. Okay, so now I would like to explain a little bit on the entry requirement. This one is a Master of Physiotherapy. You can join for full time, which is it will be 1 year program. If you join for part time, it will be 2 year program. So this is the entry requirement. So we accept the student from bachelor's degree with the minimum CGPA of 2.5, or if the CGPA is not meeting minimum 2.5, you need to have minimum 5 years working experience in the related field. So for bachelor, we have Bachelor of Physiotherapy, Environmental Health and Medical Imaging. The entry requirement as listed here, where you can be from matriculation or A-level or diploma. If you would like to know more about the entry requirement, you can visit our website at www.mahsa.edu.my. And for diploma, Diploma in Physiotherapy, Diploma in Environmental Health, and Diploma in Medical Imaging. These are the entry requirements where you need to pass in Bahasa Melayu and at least 5 credits. And again, if you like to know more and better explanation on the entry requirement, you can visit www.mahsa.edu.my. And like I announced just now, we have new program in our faculty, which is Diploma in Occupational Safety and Health. It is 3-year program. So these are the entry requirement for the program. Okay, so why you need to choose FOHS in Masa? It is because we have a lot of benefits that we offer to the students. Okay, for example, we have experienced and dedicated international pool of academic staff, and there's various study modes like conventional and the ODL, which is open and distance learning, which I think it is a very good opportunity taking into account the current situation where we have the MCO, okay, and we also have cross teaching by expert, which Masa has the most number of health discipline in a single institution among FPTS. And other than that, we also have interactive teaching and emphasize on hands-on clinical skill like face-to-face, and also we have the online platform we call SLMS for our students. Okay, in terms of clinical placement, we have a wide list of hospital and the institution or medical center for clinical and industrial placement. And among of all of our program accredited by MQA and JPA, and also with the international recognition such as dual award with ARU. And in terms of financial aid, MAHSA offer a few scholarship like listed here. We have Haji Abdullah Academic Excellence Scholarship, Foundation Scholarship, Blue Ribbon, School Teachers, Family Scholarship, and the Single Parent Scholarship. So if you would like to know about the scholarship or any financial aid that offered by MAHSA, you can find more details at www.mahsa.edu.my. So these are the body that we have collaboration and affiliation, and this is the student mobility program. Like our student went to Irio Sosei University in Japan, and then this one, our student went to Lovely Professional University in India, and the latest one, our student went to Universitas Sriwijaya in Indonesia. Okay, so please don't forget to visit our website, and we always welcome you to join us. Okay, so please feel free to contact us through MAHSA website or our faculty Facebook page to know more about our programs, or you can simply leave the comment in the box below and we will get back to you. Okay. So dear viewers, an e-certificate will be provided for this webinar, and to be eligible for the certificate, please fill in the survey form. The link to the survey form will be provided at the end of the webinar, and you can find the link in the comment section. Okay, so I think we can continue to our webinar today, which is on the hysterosalpingography. So before I introduce our speaker, let me brief a little bit about what is HSG. So HSG or hysterosalpingography, it is actually an imaging procedure that is performed to visualize the structures of the female reproductive system. And HSG is actually well known for its diagnostic accuracy in various gynaecological conditions. Okay, so without further ado, I would like to invite our speaker today, which is Ms. Hanis, to join us.
Hi, thank you to our moderator, Ms. Shafinas. Assalamualaikum and good day, everyone.
Waalaikumsalam. Okay, thank you, Ms. Hanis, for joining us today. Let me introduce again Ms. Hanis about her background. Ms. Hanis holds a Master of Health Sciences in Medical Imaging from the International Islamic University Malaysia IIUM, and she is an experienced radiographer and has been working in the clinical field before joining MAHSA as a lecturer for the medical imaging program. So with her experience and knowledge, I believe this session will benefit all the audience. So Ms. Hanis, I think the screen is all yours. You can start your screen now.
All right, thank you again, Ms. Shafinas. I will start sharing my screen. All right, so thank you again, everyone, for joining us. So today we are going to discuss in a bit of hysterosalpingography, or in short, HSG, and its diagnostic and also therapeutic aspects. But before we discuss further about HSG, I would like to introduce that today's topic is about the imaging of female reproductive system. So female reproductive system consists of the vagina, okay, and then we have a cervix, the uterus, the fallopian tube, and also ovary. So these female reproductive system are going to be imaged in the HSG. So now let's see, what is HSG? So HSG is a radiographic imaging procedure that has been used to demonstrate a female reproductive organ with the use of contrast medium, or in layman term we call it as a dye. So this dye will actually outline the uterine cavity when it is injected throughout the cervix. And these procedures best demonstrate the uterine cavity patency, or the degree of openness of the uterine tubes, as well as we can also assess the shape and contour of the uterine cavity to detect any uterine pathologic process, And the process also is an outpatient procedure that usually takes less than 5 minutes to perform, and usually done after the menstrual period ends, but before the ovulation, like between 7 to 10 days after the onset of menstrual cycle. Okay, this is to avoid the possibility that the patient may be pregnant during the procedure. Okay, so now let's see the diagnostic aspect of HSG. So diagnostic means a concern with diagnosis or illness or other problems. So we can use HSG to diagnose an illness or abnormalities of the female reproductive system. And the most common reasons to perform the HSG is to assess the infertility, and also to demonstrate the intrauterine pathology or lesions such as the endometrial polyps or uterine fibroids, and also intrauterine adhesions. And we can also evaluate uterine tube after a tubal ligation, as well as to investigate a suspected incompetent cervix or suspected congenital anomaly that causes recurrent miscarriages. So, however, this procedure contraindicated for women that is pregnant or currently having an active pelvic inflammatory disease, or having an active uterine bleeding, or is hypersensitive to the iodinated contrast medium, because in HSG, iodinated contrast medium will be used as a dye. So now let's move on to the therapeutic aspects of HSG. So we already know that HSG serves a diagnostic purpose. Okay, but HSG also can be therapeutic and increase the rate of conception. The question is how? Okay, so a study done by Adrea et al. 2017 showed that performing HSG using an oil-based contrast resulted in 10% higher absolute ongoing pregnancy rate within the 6 months as compared to the use of water-based contrast media. For example, oil-based contrast media that we use is lipiodol. Okay, and then the most common water-based contrast media we use is Omnipaque. Okay, so there are several potential mechanisms that has been suggested to increase the pregnancy rate, which can be categorized according to their location of action, like the fallopian tube or the endometrium or the peritoneum. So first we have a tubal flushing, such as a mechanical flushing of debris or mucus plugs, or unblocking of peritubal adhesion that can clear a passageway of the fallopian tube and resolving an unexplained fertility factor. So making the assumption that HSG using oil-based contrast does dislodge the debris, the mucus, etc. from the fallopian tubes, this would mean that the fallopian tubes are essentially cured, or means that the tubes are once more fully operational and back to their normal state of fertility. The second one is uterine bathing. Uterine bathing with oil-based contrast can enhance the endometrial receptivity, which an oil-based contrast produced from poppy seeds and contains opium alkaloids, which potentially interact with the opioid receptors in the endometrium or through the alterations of the uterine immune response. And the third one, the third potential mechanism is that an oil-based contrast reduces peritoneal macrophage phagocytosis and macrophage adherence by forming an oily layer of the macrophages, changing their shape and surface configuration. And previous study also showed that sperm phagocytosis is inhibited in vitro by oil-based contrast. So now we already know that there are diagnostic purpose and also therapeutic aspects of HSG. Let's go to the preparation before undergoing a HSG procedure. First, you will be asked to abstain from intercourse between booking the appointment and the time of examination. This is to avoid the chance of unexpected pregnancy while undergoing the procedure, as the radiation that we use in HSG procedure is quite high. And then you will need to shave your private parts, okay, prior to the procedure. And also you have to tell your doctor ahead of time if you have ever had an allergic reaction or you have any history of allergy. And because HSG use a contrast media that have the possibility to cause an allergy reaction. So the doctors will decide whether you can go on with the procedure or you have to take a pre-medication prior to the examination to reduce the risk of allergy reaction. And then you will also be instructed to take a mild laxative or suppositories and a cleansing enema before the procedures, which to ensure adequate visualization of the reproductive tract unobstructed by bowel gas or feces. And then you will also be instructed to empty your bladder immediately before the examination to prevent displacement of the uterus and the uterine tubes. And then you may be instructed to take a mild pain reliever before the examination to alleviate some of the discomfort associated with cramping while undergoing the procedures. And you also will be explained about the procedure and possible complication before you sign a consent form. Alright, so now let's talk about how HSG is performed. Okay, as you can see in this slide, okay, we have a image of a woman in a lithotomy position. So first you will be positioned in this position, a lithotomy position as in the picture. Then at the start of the procedure, a speculum, okay, you can see here, we have a speculum here, will be inserted into the vagina in order to view the cervix, which is quite similar to a pap smear procedure. So the cervix is cleaned with an antiseptic solution, and then a thin plastic catheter, generally about the size of tip of a pen, is placed inside the cervix. And once the catheter is placed, a small amount of contrast, like 5 ml to 10 ml, will pass through pass through the catheter into the cervix and filling the uterus and also the fallopian tubes. And then while you're lying flat on a table, a special X-ray machine called a fluoroscopy is used to provide a live X-ray images like a video that allows the practitioner to watch as the contrast fills the uterus and travels into the tubes. And the tubes are considered open when the contrast is able to move completely through the length of the tube and spilling the contrast out on the other side, which indicates that the tubes are open and available to pick up an egg post ovulation. So what should be seen in a HSG procedures? So in a normal HSG, the contrast media will flow into the uterus, okay, and highlight the uterus and flows into the fallopian tubes, okay, the middle image will flow into the fallopian tubes, and lastly it will spills out of the tubes as in this image, okay. Now we see a normal tube versus blocked tube, right? So if here, okay, if there is a spillage of contrast media, it indicates that the tube is open, while there is no spillage, okay, of contrast media, it indicates that the tube is blocked. For example, like here, it is blocked here. So the contrast media cannot flow through the fallopian tube, right? And then here in this image, okay, the middle image, see, you can see that there is a spill of a dye. Okay, it flows from to the uterus to the fallopian tube and then spill at the end of the fallopian tubes. Okay, at the left image, you can see that one tube is blocked. Okay, how? Okay, you cannot see any spillage here, right? Only one tube shows the spillage, and you can also see the fallopian tube here and then the spillage. But here you can see the fallopian tube and you can see any spillage. And then at the right image, okay, after you injected the contrast medium, it fills the uterus, okay, but it stops. It stops here. It doesn't flow into the fallopian tubes. So this indicates that both tubes is blocked. All right, and then HSG can also show other pathologic condition like hydrosalpinx. So hydrosalpinx refers to a fallopian tube that is blocked with a watery fluid, where we can see the fallopian tube is distended with a characteristic sausage-like shape here. Okay, you can see a sausage-like shape, and then we can also see a submucosal myoma, or also known as the uterine fibroid, like in the image, right? It is a uterine fibroid, or also known as a benign tumor of myometrial origin, and are the most common solid benign uterine neoplasms, right? Okay, so in this photo, you can see a round shape of radiolucency. So this indicates the submucosal fibroid. And then after the HSG procedure has come to the end, you will be given a sanitary pad, as there might be a discharge of the contrast media residue. And you will be advised that you may experience a vaginal spotting, like bleeding between 1 to 2 days after the procedures, and pelvic cramps up to 2 weeks after the procedures. And then you will given a pain reliever, as indicated by the doctors, for pain relief. And also you have to seek a medical help if you experience an increased pain, fever, or heavy bleeding after the exam. So this procedure is actually very quick, like 5 minutes or 10 minutes only. So after that, you have to wait for the results of the procedures. Right. So I think that's all from my side. I hope that this webinar helps you to understand a bit more about HSG, its diagnostic and therapeutic aspects, or as well as help you to prepare if you have an upcoming HSG procedure soon. Okay. With that, thank you and stay safe.
Sorry. Thank you, Ms. Hanis, for an insightful presentation. I believe that all the audience already gained very informative knowledge from your presentation. So, dear all viewers, if you have any question for our speaker, please leave a comment on the chat box, and I will read out all the questions for our speaker to answer. Okay. While waiting for the question from the audience, I have one question to our speaker, Ms. Hanis. Okay, Ms. Hanis, as we know, there are lots of imaging modalities in medical imaging. We have ultrasound, we have fluoroscopy, which HSG is conducted under the fluoroscopy, and then we have CT scan, we have MRI. Okay, maybe you can explain to us what is the difference between the usage of HSG and the ultrasound in demonstrating the intrauterine pathology.
All right, thank you so much, Ms. Shafinas, for the question. So basically, HSG best demonstrates the uterine cavity and also the degree of openness of the uterine tube, whether there is any blockage or whether the tube is normal. But in ultrasound, ultrasound is unable to diagnose or to rule out a blocked fallopian tube. It can show a variety of intrauterine pathology, but not the blockage of the tube. So that's the difference between HSG and ultrasound. So basically, HSG will use to see the openness of the duct, but for ultrasound, we will use for any pathology of the uterine cavity, or for pregnancy, for example. That's the use of ultrasound. And ultrasound also use sound wave. It has no radiation, and this a little bit less risk as compared to SSG, because in SSG we use contrast media, we use a high radiation dose X-ray machine. So that's the difference between the two machines in demonstrating the intrauterine pathology.
Okay. All right. Thank you, Ms. Hanis. I think we have one question from the audience. Let's see the question from Ms. Nadia Kamal. Ms. Hanis, can you explain the pain or cramps is due to what?
Okay. Usually the cramps or the pain it comes from when we want to insert the speculum inside the vagina. So some patients might feel a little bit of discomfort, but some might feel more pain. Okay, so that's sometimes insertion of the contrast media can also cause slight pain to the patient.
Okay. Thank you, Miss Nadia, for the question. And Miss Hanis, I also have another question for you. Because in your slide just now, you have shown a few images of the SSG, whether it is in normal or in abnormal condition. So during SSG, actually, what is the main appearance that you can see in the image to show that there is abnormality with the woman reproductive system? I mean, is there any specific things that we look in the image itself to confirm that there is pathology or there is a abnormality in the system of that patient?
All right, thank you. Okay, so as I mentioned previously, in normal condition, we can see in SSG, so we use the contrast media. So we will see a spillage of contrast media at the end of the both fallopian tubes. So we will insert the contrast media from into the uterus, flowing to the fallopian tubes to the end of the fallopian tubes. But if there is no spillage of contrast media, we will indicate that there is something wrong with it, maybe like a blockage or anything, or any pathology that cause the inability for the contrast media to flow throughout the end of the tubes. But HSG also can demonstrate the shape and also the control of the female reproductive system. So, for example, as I have shown you before, we can also assess hydrosalpinx or a fibroid. We'll see the abnormal shape of the uterus or the fallopian tubes, and also you will see, like I said, a round shape radiolucency that's suggesting there is any object or fibroids or polyps in the uterine cavity. So that's how we diagnose abnormality in the SSG.
Okay, thank you. I think we have another question from the audience. It is from Miss Shazana. The question is painkiller necessary for the patient before undergoing the procedure? The painkiller.
Okay, sorry. All right, thank you, Shafinas. All right, thank you, Shazana. Is painkiller necessary for the patient before undergoing the procedures? So it depends on the patient actually. It is not mandatory, I would say, because some people have low tolerance of pain and some people have high tolerance of pain. So if you think that you have low tolerance of pain and you think that maybe you will experience a great pain, you can take a painkiller before the procedures, and also this will be prescribed by the doctor. Okay, and then if during the procedure you experienced a great pain, usually the doctors will give a medication like buscopan injection, okay, to relax the smooth muscles and help you with the cramping or the discomfort that you experience during the procedure.
All right. Thank you, Miss Shazana. I hope Miss Hanis answered your question. We can go to the next question from the audience. I think we have one more. Okay, we have question from Miss Zarina. Kalau pesakit ada masalah dari segi irregular menses, macam mana kita nak tentukan tara pesakit akan buat HSG based on 7 to 14 days tu? Okay, this is a problem of the patient who are having irregular menses. So how to determine the date of the HSG appointment? Is it based on the 7 to 14 days?
All right, thank you for the question, Puan Zarina. All right, if the patient have irregular menses, this will be calculated by the physicians. They will determine the dates and they will let you know which dates that you have to come for the appointment. You don't have to calculate yourself. You don't have to worry about it. All right.
Okay. Okay, thank you, Miss Hanis, for answering the question, and thank you, Miss Zarina, for the question. And I have one more question to Miss Hanis, and I am sure that many of us will be concerned about the pain during the procedure, since if we see from the slide, the procedure of SSG is involving the insertion of the speculum or the utensils inside down there. Okay, so I just would like to know, is it very painful, or is there any way to reduce the pain or it is really what we call like tolerable pain during the procedure?
All right. Thank you, Ms. Shafina. Good question. So, whether the insertion of the speculum or contrast media is painful, or not, it depends on the person itself. As I mentioned, some might have a low tolerance of pain. Some might have high tolerance of pain, and some may feel that it is very painful, the procedures, and some might only experience mild discomfort. So, but again, if the woman undergoing the procedure have experienced a great pain, the doctor will give medication, like I said, buscopan, okay, or any painkillers, okay, to relax the smooth muscles and also help with the pain and the discomfort.
Okay. Uh, I think we have one more question from the audience. Yeah, okay. It is from Miss Nabila Natasha. The question is, Miss Hanis, means during the procedure, patient is not under sedation, right?
All right, thank you, Ms. Nabila. All right, so during the procedure, the patient is not under sedation. You are completely conscious, okay, because it only takes a few minutes of your time for the procedure to be done. So you're not going to be under sedation. Okay, but if you feel a great pain, the doctors will give you medication. Okay, but you can completely see whatever is happening around you. You can also see the live images from the screen. We use a fluoroscopy machine, so we can see live images, or it's like a video. It's like now you see me moving. It's Yes, you can see the contrast media flowing. You can see your uterus and your fallopian tubes, and your doctors will talk to you about it. Okay, and consult with you about it. So you're not under sedation, you're conscious.
Okay. Thank you, Miss Nabila, for the question, and thank you, Miss Hanis, for answering. I think that is all the question from the audience. No more question from the audience. Yeah. Okay, so I think that is all for the Q&A session with Miss Hanis. So the all audience, as mentioned in the beginning of this webinar, there will be an e-certificate provided to all the audience, and to be eligible for the certificate, you would need to fill up the survey form, and you can find the link of the survey form in the comment section, and please fill, then you can receive your e-certificate for joining this webinar. Okay, so I think with that we can conclude today's session. To our dear speaker, Ms. Hanis, thank you again for joining us today, and especially thank you for the knowledge sharing with all the audience, and to all the viewers and our audience. I also would like to thank you for joining our webinar, and we look forward to your comments and participation in our future events hosted by the Masa University. So for further inquiries, please contact us through the Masa website, or you can visit our social media at Facebook, Twitter, and Instagram. I think that is all from us. Have a safe day, everyone. Thank you.
Thank you.